Emergency teams are racing to contain a possible coronavirus outbreak in one of the world's largest refugee settlements. Cox's Bazar in Bangladesh is home to nearly 1 million Rohingyas who fled violence in Myanmar. 2 people have already tested positive for the virus in the area, a refugee and a local resident living nearby. One of them disappeared for hours after finding out he'd been infected. While they're both now in isolation, authorities worry that the virus has already spread. Now, for more on this story, Mei Wong joins us live. Mei, you've been to Cox's Bazar. You've reported from there for us. How grave is the threat of COVID-19 possibly spreading quickly there?
The Rohingya refugee settlement in Bangladesh is the largest in the world. It houses about 1 million Rohingya refugees, so it is just a tinderbox and an accident waiting to happen, really. I've been there before, gone into the camps, actually went into the shelters. At least 5 people live in one single shelter. And you can just imagine, if I stretch my arms out, I can touch one wall to another. Everyone is breathing the same air inside that shelter, coughing, sneezing without covering their mouths. And when I was in the shelter, I can't even breathe properly. I had to come out of the shelter in order to catch my breath. So you can just imagine the kind of situation over there and the kind of close proximity that the Rohingya refugees have to deal with. Another thing, the World Health Organization constantly reminds people to wash their hands regularly. Over at the refugee camps, if they don't even have enough clean water to drink, can you imagine? Do they have water to even wash their hands with it? And of course, don't even talk about having masks or hand sanitizers. That's almost non-existent, because more importantly as well, many of the Rohingya refugees don't even know the details about COVID-19 because internet access has been shut out from them since September of last year. They have no access to information. And one final point on this matter is that the monsoon season is just around the corner. So you can just imagine that that is going to just exacerbate and obviously perhaps pose a threat to COVID-19 infection over there.
May, so who will be providing help in testing and isolating possible cases in this massive refugee camp then?
Logically, you would expect the Bangladeshi government to do so because they are seated in the territory of Bangladesh. But you must also remember that Bangladesh is one of the poorest countries in the world. They too are struggling with COVID-19 infections of their own. They too have had a lot of strains on their own healthcare system. Give you an example, 160 million population in Bangladesh alone, and they've only tested 160,000. Can you imagine that? So what more, the testing of the Rohingyas in the resettlement camps? From what I understand, the UN Refugee Agency put out a statement to say that since April, they've started to do testing, but they've only tested about 100 Rohingya refugees, and that is of 1 million Rohingya refugees. So you can just imagine the scale that they would have to go through. And obviously you have international non-government organizations helping out. But you must also understand that it is almost an impossible task going forward.
Thanks for speaking to us and explaining that to us. Mei Wong speaking to us from Bangkok.